Instruction Training Video, Bathing with an IV Line. This video has been provided by the Johns Hopkins Home Care Group and the Johns Hopkins Division of Infectious Diseases. Thank you in advance for watching this video. You have been discharged from the hospital with an IV line. This IV line is usually inserted in your arm, such as PICC lines or midlines, or can be inserted in your chest, such as with Hickman catheters. It is important that you understand how to care for your IV line at home to prevent any complications from occurring. This video will provide you with some tips and tricks in managing your IV line at home when bathing. Please watch this video as many times as you need. If you have a caregiver, family member, or friend helping you, please have them watch it as well. Please know that your IV line can lead to an infection. It is important that you keep your IV line and the dressing over that line as clean, dry, and intact as possible. The IV line dressing itself will be changed by your home health nurse every 7 days. We do not want to change the dressing more often than every 7 days unless the dressing is dirty or is no longer sticking to the skin to decrease the risk of infection. If the dressing is not sticking to the skin well or it is dirty, then there is a risk for infection. This is why it is important to care for your IV line dressing. Bathing is one of the more challenging daily activities to do when you have an IV line. If you are connected to an electronic pump, try to bathe when you are disconnected from the pump, like when you are changing the medication bag. However, please check with your nurse or pharmacist to make sure it's okay to disconnect your pump from your medication. If it is not okay to disconnect your pump from your medication, please make sure to cover the pump before bathing because the pump is not waterproof and it could be damaged if exposed to water. Whether or not you have a pump, when you bathe, make sure the dressing and the line are protected from getting wet. No matter what, you should avoid any direct flow of water on your IV line. Don't let the line get under the water. If your shower has a detachable shower head, use the shower head to keep the flow of water away from your IV line. To cover the dressing over the IV line, we recommend the following methods. First, you can purchase a special cover, which is designed specifically to protect your IV line when bathing. These coverings work best on IV lines in the arm, like PICCs or midlines. If used correctly, these protective coverings will help to protect your IV line from becoming wet. If you decide to use one of these items, they are not provided by your home infusion agency and are generally not covered under your insurance plan. You can search the internet for these devices or ask your nurse or pharmacist for recommendations if desired. Please be sure to read the instructions provided with these devices and use the items as directed. Second, you could use a special form of cling wrap that has a sticky layer. One brand name is Press and Seal Wrap. This product can be purchased at most grocery stores. Either wrap the cling wrap around your arm, covering your entire dressing and tubing, or take the cling wrap and place it over your chest line. Make sure the cling wrap sticks to both your skin and itself. The cling wrap should be secured, but not tight enough to impact the device or cause any discomfort. You can use loose rubber bands above and below the IV line in your arm to make even more certain the cling wrap stays in place. A third option is to use a clean, long, narrow plastic bag with the bottom cut out of it, like an umbrella bag. Do not use a bread bag or a newspaper bag, as these may contain crumbs or outdoor dirt. Get your clean umbrella bag and cut out the bottom. Hold this bag in place over the IV line in your arm with rubber bands at the top and bottom of the bag. Again, make sure the rubber bands are not too tight. If it causes discomfort, this may be a sign that it is too tight and is cutting off blood flow. It may take a few tries to get a solution that works for you. If you need any assistance, please contact your home health nurse. Good job. Enjoy your day.